But back to the whole advent of the internet, chat GPT, intellect, knowledge, and wisdom. I try to tell people will bring me stuff from chat GPT or, other AI models. They'll bring me things that they've searched on the internet. And I'll say, okay, like this isn't necessarily wrong. It's just not right about you.
Yeah. Yeah.
Like, and that's what we're interested in.
Right.
One of the great paradoxes of clinical medicine is, if you think about the bell curve, right? The famous, all right. And so in the bell curve model says to practice safely and effectively, you really need to know about plus or minus 2 standard deviations from the mean, what constitutes the developmental norm, and distribution of characteristics. All biological characteristics seem to follow that if you collect a large enough sample that exists on a bell curve. But the clinical conundrum, and again, back to I've got some 6 or 8 or 12 week or even a 1-year study, which is a short time in the development of a human being. And it said that this particular intervention yielded this particular result. It's like the study tells you about a trend in a population, right? Which is great. It's helpful. You got to have that. And in fact, I would, again, to be fair, you can't practice safely without that. You need that knowledge base.
Right.
However, then we have the paradox that we're sitting with a group of 1 and we don't know where they are on that bell curve.
Right.
And so your job is to discover where this person is.
Right.
And guess what? Again, they're not always where you think they're going to be.
Yeah. Right.
And they don't always tell you right away either.
Yeah. They may not know what to tell you. That's another thing you've thought of elsewhere. It's like, why 15 minutes is not enough time? Because there may be something super relevant, and you're like, because we have blind spots. We all have blind spots. That's one of the ways that the mind works to protect us.
You're spot on.
Yeah.
You're absolutely spot on. And one of the things that good doctors in my world, this type of medicine do, is they teach people how and what to tell them. Like by asking questions.
Interesting.
Does that make sense?
It's almost like a leading question, but one that's not, it's not necessarily leading to a result, but it does presuppose maybe 2 options.
No, Andrew, people ask me, or people say to me all the time, no one has ever asked me this. And they'll have been to a half dozen different.
Can you give me an example of a question that people will say without kind of?
Some of them are basic things. I mean, like just very basic things that I would consider like just, people that have had chronic treatment refractory, let's say, depression or anxiety. And no one's ever asked them about the possibility of hypomania or mania, which would, change the course of their treatment. No, head injury. People say, no one's ever, why are you asking me about head injury? I'm like, and again, like.
It's almost like the brain isn't relevant to psychiatry.
Yeah. Well, the historical criticism, the only specialty that doesn't examine the organ it treats.
Right. Yeah.
And that's changing. Imaging technologies come along, quantitative EEGs, functional MRI, PET, SPECT. Dan Amon's made a whole career out of SPECT. Yeah. I mean, it's like, there are ways to kind of look at it and to explore what's under the hood now that didn't exist. Mm-hmm. But when I say people say, oh gosh, no one's ever asked me that, I'm talking about things that I would think of as basic things, like not asking me, for example, about, if you've traveled. Like ask people that, have you traveled? Because, people get exposed to things.
Right.
Both
yeah.
traveling. And we've got a patient right now who had an abrupt onset of some particular symptoms that could be construed as pandas. And this person has had exposure to a parasite. And sure enough, although it's traditionally associated with strep, there are reported cases of parasitic infections producing the antibody that attacks the basal ganglia and produces a abrupt onset of
PANDAS is what is PANDAS again? It's a neurological?
Pediatric autoimmune neurological disorders associated with strep. It's quite it's an acronym.
PANDAS. Right.
Yes,
okay.
PANDAS, of
PANDAS,
course.
okay.
Of course, PANDAS.
Yeah, right.
They're the jolly bear from
Got it. Yes, I remember. Yes. I remember the one that everybody's really fascinated with. Its next life. Yeah.
Yes.
Yeah.